This first group of muscles are going to be muscles that are going to help you with your facial expression. So they're going to help you to move your face. And there are 22 distinctive muscles that are going to be visible that you have for facial expressions. One of the things I do want you to notice is this occipital frontalis. So you can see right here the occipito frontalis, so your frontal bone, of course, and occipital is going to be down here at the base of your skull. Notice this is a one long continuous muscle that's going up and around the top of your head. And then notice you have like this white sheath looking part at the top of it. That is going to be your epicranial aponeurosis. Epi on top of cranial, your cranium, and aponeurosis is going to be a connective tissue that is going to be like a tendon, except it's going to be very flat and sheet-like, whereas a tendon is going to be like a cord-like structure that's attaching the end of the muscle to a bone. So the epicranial aponeurosis is going to have this white section where it's on top of your cranium. So you will have both the frontal belly, and then you will also have the occipital belly of the occipital frontalis. I'm not going to go through all these different muscles in here. You know which ones that you're going to have to label. But again, keep in mind that this grouping is going to help you produce your facial expression and move your face in different ways. Now this one's going to show the different eye muscles and how you're going to be able to move your eyeball all around. So if you want to look right, left, up and down, diagonal, these are going to be the muscles that are going to allow you to do that. So notice you're looking at the medial and the lateral views, and then the anterior view as well from the front, and then anterior view, but then the eyeball itself removed so that you can see where the muscles are coming from. So you can see all these long stringy muscles that are coming from this base back here in the backside of the orbit of your eye. So keep in mind what kind of bones are going to be in here creating this orbit. You should remember that from this unit that we did on the skeletal system. So make sure you're able to name those bones there as well. But if you see here down here at this section right here, you have your optic nerve right there that is going to be connected to the eyeball, and that's how you're going to have vision. The signals are going to come through your eyeball, they're going to go down through your optic nerve, and then they're going to go to your brain to be interpreted. But notice on either side of it here we have all of these muscles that are coming out of this center point. These muscles are not controlled by that optic nerve. The optic nerve is just for visual stimuli. These muscles, though, are going to be controlled by this oculomotor nerve. So oculomotor nerve is going to be cranial nerve 3. The optic nerve 2 for vision is going to be this one. So I'm not going to make you know that for this test, but later when we start talking about the unit 4 with the nervous system, you will have to know some of the cranial nerves associated with those. But do notice we're going to have superior. So superior, of course, means that it's on the top. You're going to have inferior muscles down here. You're going to have oblique muscles. You're going to have rectus muscles. So oblique means it's coming in from a diagonal. Rectus means it's going to be a straight muscle. So just keep that in mind that as you're going through these, put the proper words together so that you're able to figure out exactly what they are going to look like and where they're going to be located in terms of the naming scheme that we have for our muscles. So these are going to be controlling what direction your eye is going to be moving in. So I would like you to think about it logically. If I were to pull on this lateral rectus, so if I pull on this, well, what is my eye going to do? So this is the lateral view, so you can see the nose here. So if I were to pull on this, then the eye would turn outward laterally as well because I'm contracting this muscle. So make sure you're able to figure out exactly what direction the eye is going to move when these different muscles are going to contract. Muscles of mastication are basically chewing muscles. So the muscles that you are going to be using to move your jaw up and down, like when you're going to be chewing food. A lot of people think that's going to come from your jaw, where there are some muscles here that are going to be in your jaw that are causing that. You do not need to be able to identify these ones in particular. The one you do need to know is going to be the masseter muscle right here. It's coming from that zygomatic arch of that zygomatic bone and going all the way down to the mandible. But a lot of your chewing power is actually coming from the temporalis right here. So if you were to actually put your hand on your temporal bone, you'll feel that temporalis muscle right on top of it. And then if you chew back and forth, and like you're chewing some gum, you will actually feel your head flexing. So a lot of your chewing power is actually coming from that temporalis muscle as opposed to jaw muscles. One of the interesting things that we have in terms of chewing is that oftentimes people think of their jaws moving back and forth. So you have your upper jaw, your maxilla, and your lower jaw, your mandible. When in actuality, your maxilla is actually fused to the rest of your facial muscles and can't actually move. And so when you are chewing and talking and moving your mouth, you are doing it by moving your mandible only. So your mandible is the one that's going to have those muscle attachments and going all the way up to your skull so that you're able to have and produce that force needed for the mandible to move up and down in order to chew your food. We're going to continue with looking at the muscles that are part of the head and then moving down to the neck as well. And now we're specifically going to look at the muscles of the tongue. So for the muscles of the tongue that you need to know, I want you to be able to relate these to structures that you already know and root words that you already know. So we already learned the styloid process right here. So the styloglossalus, that's going to be the muscle attached to the styloid process down here, and it's going to be coming downward here as part of the tongue. Now it's styloglossalus, glossalus like glossary, having to do with language and words. So hyoglossalus, that glossalus again that you're seeing, and it's hyoglossalus because it's going to be connected to the hyoid bone right here. So remember, the hyoid bone is the only bone in the body that is not articulating with any other bone, and it's going to be anchoring, in fact, the tongue. And so there's that muscle of the tongue that is going to be anchoring. Moving on into the neck region, so in the neck for our axial skeleton, again, there are some different ones that you should know. So stylohyoid, so again, our hyoid bone, our styloid process, which is going to be over there. So you should be able to identify the hyoid bone, the thyrohyoid, so again, your hyoid right here, and then your thyroid gland is going to be right down in there too, so it's kind of going down into that area. You should always know your sternocleidomastoid, no matter what view you're going to be seeing it from. You should be able to see it's attached to the sternum and the clavicle at these two different points down here. So again, here's our clavicle. You should be able to identify that. You should be able to identify the mandible. Still within the axial muscles, we're going to look at the vertebral column. So for our vertebral column, the main muscle group that we're looking at are going to be the erector spinae. So the erector spinae are going to be a group of muscles that are holding your vertebral column upright and allowing you to have motion where you're able to flex and bend as needed with it. So erector, of course, is something that stands upright, and spinae attached to our spine. So when we think of our spine, remember our spine, and people usually are referring to the spinous process that's coming through, which is only one aspect of the vertebral column that we have. We have both a superficial and a deep layer of the erector spinae. So let's look at the superficial layer. So this is closer to our skin. There are going to be three major groups of muscles within it: the spinalis, the longissimus, and the iliocostalis. These groups are going to tell you basically some sort of description of where it's located or what it's attaching to or how it looks. So within this group, I'm really concerned with you knowing spinalis is going to be a major group that's going to be this superficial layer. Because notice underneath it in the deep layer is this semi-spinalis group. So the semi-spinalis group is going to have three major categories with it that you will need to identify. Again, look at the names: capitis, having to refer to the head; cervicis, referring to the neck; thoracis, referring to the chest or thoracic area. So make sure you're making these connections with the names and where they're located. So iliocostalis, ilio, the ilium; costal, the ribs; lumborum, lumborum like the lumbar region. So all of these terms are giving you descriptions to let you know where they are and what they do. This is an interesting view if you are going to look at and remove these other ones. You can see these muscles underneath it, and it's showing you the muscles that are spanning across the different vertebra. So of course we have our spinous process here, and then you have your transverse processes on either side. This is really a good view to show you why we have all these processes, because we have all these different muscles that are going to be attaching. The interspinales, they are going to be between the spines. So there are going to be muscles that are going right between there. And then of course you have ones that are going to the transverse processes. So all of these are going to have a different way of attaching to the spine, which is why we have these irregular shaped bones for the vertebra. This is a neat view because this is the only part that's going to be an anterior view. So this is like the front of the view that you have, and here's going to be the base of your skull, and then you have your vertebrae that are going to be down here. So notice the front is also going to have muscles. So muscles are really going around all parts of the vertebral column. Now we're looking specifically at axial muscles of the trunk. In particular, we're looking at ones that are going to also help us breathe, and they're going to help to oppose the muscles that we looked at for the erector spinae. So the first area that we're looking at here with the anterior view, this is similar to the last view that we just saw where you have the head here and you have the vertebral column. You are going to have the scalene muscles. These scalene muscles are going to attach front, middle, and back, and they are going to go from the skull down here and then move all the way down to the ribs. So these are going to allow us to attach the ribs so that every time that we're breathing, it's going to contract that rib cage for us, and it's going to lift and flex it. A lot of times when people think of breathing, they think of their lungs expanding and collapsing. Well, lungs are not made of muscle tissues that are going to allow them to expand and contract. What you're actually expanding is going to be your rib cage. So your rib cage lifts up and out, and when you do that, your lungs basically come with it that allow them to expand as well. So the scalenes are going to help us do that. Moving down here, we have an anterior view of all these trunk muscles. So the ones you have to know again are going to be the highlighted ones that you see here. Looking at them, when you see oblique, remember oblique is just going to be some sort of diagonal muscle. Rectus muscles are going to be straight muscles. So the rectus abdominis you can see here is running up and down. That's what people refer to as their six pack. You have actually more than six of them though, so you just can't see the rest of them. But notice this is going to be an underlying structure to where the external obliques are going to be on top of it. So the external obliques are there, and then you have your rectus abdominis that's going to be underneath it. We're also going to have these serratus anterior. Serratus looks like a serrated edge, the way that they are attached to the ribs. One thing I do want you to look at is going to be this linea alba. So the linea alba is going to be a line that's running straight through the rectus abdominis on either side of them. So it's going to be that sheath. And notice there is another sheath that's going to be between each of the rectus abdominis muscles. One of the things I want you to take away from this is I want you to be able to identify these muscles based on whether you're seeing them from the superficial or anterior view, and then as well as with a cross section. So here we've taken a cross section, and this is a superior view of the diaphragm. So we have cut right here, right underneath the rib cage, and then we can see the muscular diaphragm here, and we're looking at it from above. And then of course this is going to be the posterior end, and this is going to be the anterior end. So here's our xiphoid process. That's going to be the bottom portion of the sternum on our rib cage. And then you can see all these little blue things. These little blue things are the cartilage that we cut through that's holding the ribs to the sternum. So those are costal cartilages. So looking this, you should be able to tell the different muscles based on the depth that you're looking at. So here's our rectus abdominis on either side. So again, here's our rectus abdominis and rectus abdominis. They would be either side right here. And then we have our external obliques, which are going to be on either side of it. You can see our xiphoid process again telling us the center. And then all of this is going to be diaphragm that's separating your thoracic from your abdominal pelvic cavity. Here's our serratus anterior that we saw over here. And then, of course, our erector spinae groups. So we just talked about that on the last slide with those erector spinae groups on either side of the spine, helping us to keep our posture and keeping it upright. Now, this is going to be a similar section, except it's going to be further down. So notice this is right below the belly button. So we're going through the abdominal cavity. And so you can still see our rectus abdominis. Notice we're past our rib cage, so there's no costal cartilage, no xiphoid process. So rectus abdominis on either side. And then look at this. You can better see which muscles on top of what. So you can see our external oblique is going to be the very outer region right here. Then we have our internal obliques. And then the last one on the inside is going to be our transversus abdominis that's wrapping all the way around. Hey, quadratus lumborum, that's something that you had to know for that erector spinae group as well. So be able to identify those two.